My name is Michael. I am a student physical therapist assistant. This is Anastasia, my model. She'll be helping me today to demonstrate proper progression of lumbar stabilization exercises, specifically the neutral spine position progression. For all lumbar stabilization exercises, the patient must first get into a neutral spine position and maintain that during each exercise. To begin, I'll have the patient lie supine on her back with knees slightly bent, feet flat on the floor, and feet hip width apart, and arms to the side. A towel roll can be used underneath the patient's neck for comfort. Okay. And then a pillow can be used under the patient's knees for comfort as well. Okay. In neutral spine position, there should be a space between the patient's low back and the floor. You can test this, and you should be able to easily slide your hand underneath the patient's low back and the floor. If the patient cannot maintain the neutral spine position, the patient must use the draw-in maneuver to stabilize the core musculature. To perform this draw-in maneuver, we ask the patient to inhale and pull their navel towards the floor using their abdominal muscles. Let's try that again. So inhale and pull, good. And as they exhale, their back should drop back down towards the floor. Make sure you're maintaining that space under the low back. This is referred to as a transverse abdominis set. It's important to not make this movement forceful. It's meant to be a small movement. You can progress this exercise when a patient can properly maintain this neutral spine position during normal inhalation, exhalation, maintaining good abdominal control. The next progression for this exercise can be performed with raising one arm overhead in an alternating fashion. So we have the patient inhale and pull their navel towards the bottom and raise one arm up. And exhale, bring the arms to the side. Okay, and the other side. So inhale, tuck that tummy in, good, excellent. The next progression would be with both arms raised overhead. So inhale, tuck that tummy in, both arms up, good, and down, and relax, great. The next step after this would be with one leg raised up. So go ahead and raise your left leg up. Left leg, just the leg up, there you go. And inhale the tummy, good. And then lower it down, relax. And the other one, good. So this is in an alternating fashion as well. The step up after this would be with one arm raised and one leg raised. So go ahead and raise your arm up and your leg up. Good, and then lower it back down, and the other side, excellent. At this level, you could also perform this with alternated hands and feet. The next step after this would be both arms raised up with one leg alternately raising. So go ahead and raise up, excellent, and back down. And again, same. With the other leg. Good. Great. Lastly, the patient should be able to walk their feet out, so straighten your legs out while maintaining that neutral spine alignment, and both arms overhead. So reach out overhead. Good, and then just breathe normally. Great. So that is the final progression of neutral spine alignment, and this concludes my video on proper spinal positioning.